In this series, we are here to help you clear your NMC CBT exam. Every alternate day, we'll present you with 20 multiple-choice questions and their answers to boost your knowledge and to supercharge your progress. We've got a weekly master video with a whopping 120 MCQs. Don't miss out on this opportunity to excel. Let's dive right in. Question 1. Which of the following is a sign of dehydration in the elderly? Option A, diminished skin turgor. Option B, hypertension. Option C, anxiety attacks. Option D, pyrexia. The correct answer is A. Question 2. The nurses on the day shift report that the controlled drug count is incorrect. What is the most appropriate nursing action? Option A, report the discrepancy to the nurse manager and pharmacy immediately. Option B, report the incident to the local board of nursing. Option C, inform a doctor. Option D, report the incident to the NMC. The correct answer is A. Question 3. When using crutches, what part of the body should absorb the patient's weight? Option A, armpits. Option B, hands. Option C, back. Option D, shoulders. The correct answer is B. Question 4. Under the carer's equal opportunities. Act 2004. What are carers entitled to? Option A, their own assessment. Option B, financial support. Option C, respite care. Option D, all of the above. The correct answer is D. Question 5. How can patients who need assistance at meal times be identified? Option A, a red sticker. Option B, a color serviette. Option C, a red tray. Option D, any of the above. The correct answer is D. Question 6. How should eye drops be administered? Option A, pulling on the lower eyelid and administering the eye drops. Option B, pulling on the upper eyelid and administering the eye drops. Option C, tip the patient's head back and administer the eye drops into the cornea. Option D, tip the patient's head to the side and administer the eye drops into the nasolacrimal system. The correct answer is A. Question 7. Which of the following are not signs of a speed shock? Option A, flushed face. Option B, headache and dizziness. Option C, tachycardia and fall in blood pressure. Option D, peripheral edema. The correct answer is D. Question 8. Compassion in practice. The culture of compassionate care encompasses Option A, care, compassion, competence, communication, courage. Commitment to compassion in practice. Option B, care, compassion, competence. Option C, competence, communication, courage. Option D, care, courage, commitment. The correct answer is A. Question 9. When collecting an MSU from a male patient, what should they do prior to the specimen being collected? Option A. Clean the meatus and catch a specimen from the last of the urine voided. Option B. Clean the meatus and catch a specimen from the first stream of urine approx. 30 mls. Option C. Clean the meatus and catch a specimen of the urine midstream. Option D. Ask the patient to void into a bottle and pour urine specimen into the specimen container. The correct answer is C. Question 10. A patient puts out his arm so that you can take his blood pressure. What type of consent is this? Option A. Verbal. Option B. Written. Option C. Implied. Option D. None of the above. Or consent is no required. The correct answer is C. Question 11. On checking the stock balance in the controlled drug record book as a newly qualified nurse, you and a colleague notice a discrepancy. What would you do? Option A. Check the cupboard, record book, and order book. If the missing drugs aren't found, contact pharmacy to resolve the issue. You will also complete an incident form. Option B. Document the discrepancy on an incident form and contact the senior pharmacist on duty. Option C. Check the cupboard, record book, and order book. If the missing drugs aren't found, the police need to be informed. Option D. Check the cupboard, record book, and order book and inform the registered nurse or person in charge of the clinical area. If the missing drugs are not found, then inform the most senior nurse on duty. You will also complete an incident form. The correct answer is A. Question 12. Which of the following is a severe complication during 24 hours? Post-liver biopsy. Option A. Pain at insertion site. Option B. Nausea and vomiting. Option C. Back pain. Option D. Bleeding. The correct answer is C. Question 13. A patient recently admitted to hospital, requesting to self-administer the medication, has been assessed for suitability at level 2. This means that Option A. The registrant is responsible for the safe storage of the medicinal products and the supervision of the administration process, ensuring the patient understands the medicinal product being administered. Option B. The patient accepts full responsibility for the storage and administration of the medicinal products. Option C. None of the above. The registrant is responsible for the safe storage of the medicinal products. At administration time, the patient will ask the registrant to open the cabinet or locker. The patient will then self-administer the medication under the supervision of the registrant. The correct answer is C. Question 14. What is the name given to a decreased pulse rate or heart rate? Option A. Tachycardia. Option B. Hypotension. Option C. Bradycardia. Option D. Arrhythmia. The correct answer is C. Question 15. Mergreen, a COPD patient, was sent home with oxygen prescription at 2 liters per minute. He is dyspneic, anxious, and panicking when you visited him. What is your most immediate nursing action to relieve dyspnoea? Option A. Call the emergency department for an ambulance. Option B. Increase oxygen rate. Option C. Tell patient to calm down in a loud voice. Option D. Calmly instruct patient to do deep breathing. The correct answer is D. Question 16. What is the most common complication of venipuncture? Option A. Nerve injury. Option B. Arterial puncture. Option C. Hematoma. Option D. Fainting. The correct answer is C. Question 17. What are the principles of gaining informed consent prior to a planned surgery? Option A. Gaining permission for an imminent procedure by providing information in medical terms. Ensuring a patient knows the potential risks and intended benefits. Option B. Gaining permission from a patient who is competent to give it by providing information, both verbally and with written material relating to the planned procedure, for them to read on the day of planned surgery. Option C. Gaining permission from a patient who is competent to give it, by informing them about the procedure and highlighting risks if the procedure is not carried out. Option D. Gaining permission from a patient who is competent to give it, by providing information in understandable terms prior to surgery, allowing time for answering questions and inviting voluntary participation. The correct answer is D. Question 18. Which of the following is not one of the 6 fundamental values for nursing, midwifery, and care staff, set out in Compassion in Practice Nursing, Midwifery, and Care Staff? Option A. Care. Option B. Consideration. Option C. Communication. Option D. Compassion. The correct answer is B. Question 19. At what stage of the nursing process does the revision of the care plan occur? Option A. Assessment. Option B. Planning. Option C. Implementation. Option D. Evaluation. The correct answer is D. Question 20. When selecting a stoma appliance for a patient who has undergone a formation of a loop colostomy, what factors would you consider? Option A. Patient dexterity, consistency of effluent, type of stoma. Option B. Patient preference, type of stoma, consistency of effluent, state of or istomal skin, dexterity of the patient. Option C. Patient preference, lifestyle, position of stoma, consistency of effluent, state of peristomal skin, patient dexterity, type of stoma. Option D. Cognitive ability, lifestyle, patient dexterity, position of stoma, state of peristomal skin, type of stoma, consistency of effluent, patient preference. The correct answer is D.